You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, replacing missing teeth with dental implants. According to my first guest, she says nobody should be wearing a loose-fitting denture. We're talking about dental implants today. With us, we have the Texas go-to implant dentist, Dr. Kari Blankenship. Dr. Blankenship, welcome to the program.
Thank you for having me.
So for people that don't know your practice, like who's the typical implant patient that comes in to see you?
Yeah, I think that's a good question. I find that there's two categories. The first set of people are folks that have either had a denture their entire life and they're very frustrated with those dentures. You know, the denture is a removable set of teeth. You know, they're teeth that you brush in your hand, not in your mouth. Okay. And they're tired of that, right? They can't eat certain foods. They're having difficulty with it staying in their mouth even when they're just talking and just, you know, day-to-day life. And for those people, we can, you know, transition them into a set of teeth that stay in permanently with a set of implants on the top and the bottom.
Now, we talked on the phone. Is this accurate that for some patients on the day of the procedure, like let's say a denture, they can walk in with no teeth and walk out with upper and lower teeth that don't come out, supported by implants?
Absolutely, 100%. You know, there's always going to be a little bit of planning involved, and we want to get to know our patients and understand what their goals are. Once we have everything set up, then we basically have the teeth made prior to them even walking in the day of the surgery, right? So if they don't have their teeth, of course, we're not worried about removing teeth or anything. The goal at that point in time is to place the implants and then to secure a set of teeth on those implants. So top and bottom, they walk out of the office with a set of teeth that are completely set in their mouth, and they can't be taken out.
I mean, like in the other room, they're being printed.
We do.
Is that right?
Yeah. My office is really transitioned into something that's fully digital. And so one of the biggest complaints I hear from a lot of denture patients is that they don't want to have traditional impressions. You know, those putties that go in the mouth, you know, people gag and they're frustrated and it tastes bad. They really, really hate that. And so I've eliminated that in my practice completely by using a digital scanner. So we scan the gums, and that's how we...
Like with what? Like a little, like a wand that goes in their mouth?
It's a little camera, yeah, and it takes a very, very accurate image of all of the contours and all of the, you know, the nooks and crannies of the gums, and so we can really get you know, a set of teeth, you know, basically fabricating, you know, behind the scenes, right? So we know what the gums look like, we know what the shape looks like. We talk to the patients about how they want to smile and what they want to look like. Sometimes they bring me in pictures of when they had teeth, you know, from 20, 30 years ago, the teeth that they were proud of. And we go from there. We design them together, and when they come in for the day of surgery, the implants are placed, and those teeth that we have been designing behind the scenes and the ones that we're printing in the office then get attached to those implants, and they stay in. So this patient used to take their dentures out and maybe brush them a little bit and soak them overnight, and now they have a set of teeth that they brush in their mouth. It's really amazing.
But what do they like more? How it looks or what they can eat?
Oh, that's an interesting question. I would say probably what they can eat. However, almost every single patient that's had this procedure always says, I didn't think I could look this good.
That's nice.
Yeah.
What's that like when they see their face in the mirror for the first time?
It's amazing. Yeah, it's amazing. I mean, this is the reason why I love doing these types of procedures, because it is life-changing. I mean, I watch somebody go from maybe covering their mouth because they don't like their teeth, you know, maybe they're unhappy with the appearance of their dentures, or maybe the fact that they're worried that the dentures are going to fall out or rock or flip or flop, you know, things like that. And so when they have a set of teeth that they can be proud of and they can talk, they can enunciate better, you know, you can hear them speak clearly, and they can eat more. You just kind of see them light up. And to me, that's like the most fabulous day of my life, because you see them go from someone who really thought that they didn't have a lot of hope and felt like they were hopeless in so many different ways. And then we offer them a set of teeth that they just are, I mean, they're beaming. They're so incredibly proud and they're so incredibly happy. And if you ask them, you know, what made you finally come in to start talking to us, you know, and they just said, well, you know, maybe a friend referred them, or maybe they kind of saw something on a billboard about implants, but it took them so long to call because they literally did not think that there were any options out there. They thought that the denture was kind of the end game, right? And you had asked earlier what type of patients come in, right? The second category would be people who have had issues with their teeth their whole lives, right? And that can be somebody who is really susceptible to decay. You know, they're constantly getting fillings, root canals, crowns. They're tired of having dentistry fail constantly. Tooth falls out here, replace there, things like that. Or maybe they've got, you know, a disease in the mouth that they can't control. They've got some form of gum disease, which causes them to have recession.
Is that a bacterial infection?
Yeah, absolutely. It's 100% a bacterial infection, right? So this bacteria gets embedded underneath the gums. It causes bone loss. And, you know, as that bone progressively gets smaller and smaller and smaller, the teeth are loose. They flare. People who used to have no gaps in their teeth now have gaps in their teeth. They can't eat the same foods that they used to be be able to because the teeth don't have the sturdiness that they did. So for those patients as well, we also look at these implant options, right?
Yeah, but what if you have bad gums? Are the implants more likely to fall out? I mean, can you still do this if you have bad gums?
100%, 100%. In fact, that's the majority of people that we see, things commonly known as gum disease, right, or bad gums, and, that comes with the loose teeth and the flailing teeth and the bad breath. There's so many symptoms that people experience when they have this bacterial infection in their mouth. When they come and see us, not only are the implants a perfect solution because that bacteria infection lives between the teeth and the bone and the gums, right? Okay. So when the teeth are then removed, it removes the bacteria that's causing these problems, right? So that's why the implants are such a great solution.
These so-called bad bugs go away.
Yeah, absolutely, absolutely, right? Yeah.
Their breath gets better?
100%, because all of that, the stinky breath, people say that my husband doesn't want to kiss me, my wife doesn't want to kiss me, or maybe somebody was rude to me, they backed up to me when they were in public. All of those things that people experience on a daily basis when they have gum disease, when they have this bacteria, all of those things are caused by the presence of the bacteria. So when the bacteria is gone, breath gets better, the love life improves, they can talk to people in public closer without fear. And so it's, again, another thing that is just so incredibly life-changing about having the upper and lower implants.
Correct me if I'm wrong here. How dental implants are typically done. You go to one doctor that does the surgery. You go to another doctor that puts the teeth on top, and then oftentimes get them maintained elsewhere. At your office, you do both parts. Is that why you do it so quickly?
Correct. Yes, 100%. My goal is to make things as efficient as I possibly can for patients. I mean, I love being a dentist and I love what I do, but I am very, very familiar with the fact that the dentist is not most people's favorite place to go, right?
Yeah.
So
do you hear that still? Sorry to interrupt, but
all the time.
Like, no offense, doctor.
Yeah, absolutely, all the time. I mean, every single day somebody says, it was nice to meet you, and don't take it personally, but I hate the dentist, right?
Is your goal secretly to kind of like win them over?
Always.
Okay, good.
Always, yeah. No, I think my team and I are very good at really trying to achieve the best bedside manner that we can. We really want the patients to feel comfortable. We want them to feel at ease. We want them to feel like they're a part of our family. So it's not about, get in and get out as quick as possible. I don't run one of those practices where I'm popping up all the time, constantly seeing a million different patients. We schedule things out appropriately so we can really connect with people, because I feel like in order for me to help somebody achieve whatever their dental goals are, I really need to understand who that person is. So we spend time connecting to people. But yeah, I mean, people tell me all the time that it's really difficult for them to find the motivation to go see a dentist because they've had a bad experience.
You say they wait too long.
Yeah. To
fix their teeth.
Correct. Yeah. I mean, and so that's how we run into some of these problems, right? Pretty much, dentistry is not that different than a lot of things that you experience in life. If you've got a really, really small problem, it's pretty easy to fix, right? If it's a bigger problem, it's a little bit harder to fix. So, people that might have had a bad experience as a child when they went to the dentist and they didn't go to the dentist, after their parents stopped making them go, they didn't go for 30 years. Well, now we have 30 years of things to catch up on.
Is that common?
Very, very common. Very common.
You say you don't judge?
Not at all. Not at all. No, because I understand. I mean, the people with anxiety, when they come in, maybe their anxiety is something they experience all day, every day with a lot of things. Anxiety is kind of a crazy thing because maybe you only have anxiety about one thing, and maybe that anxiety is literally just the fear of the dentist. But I can relate to having anxiety. I'm a high anxiety person, so I can understand somebody who really has a lot of, fear involved with, especially with something that they're not that new.
You do very well. You excel with high anxiety patients, you say.
I do. Yeah.
I mean, you like that type of patient. Because I've had doctors that say, I'm not a fan of that type of patient.
Right.
But you like them.
Well, I think I can relate to them, right?
Okay.
And so I'm not fearful of treating people with high anxiety, right? There's some people out there, whether you're a doctor or a dentist or any field, it's difficult to connect with somebody who has anxiety because a lot of times anxiety comes out in aggression or anger, or they don't mean to be rude, but they are, and I think I understand that a lot better because where they're coming from is fear, right? They're coming from the fact that they're not comfortable because even for people that don't have anxiety, the dentist isn't people's favorite place to go, right?
Yeah.
And so we do want to make that as comfortable as possible. And, my experience at the VA also really contributed to my ability to help people with anxiety because the VA is a very unique place to be. It's a wonderful place to be. You get to help veterans every single day, but it was very, very, very common for people to have a lot of trauma, PTSD. So in addition to the scope of dentistry that I learned when I was at the VA, it was also managing people's anxiety and their expectations.
Now, everybody's numbed up, and you say you offer all levels of sedation.
Correct.
Are a lot of people getting IV sedation?
Yes.
Okay. It's safe?
It's very, very safe. It's incredibly safe.
What are you monitoring?
Well, we monitor everything. What I've learned over the years, I became fully licensed to do IV sedation when I was at the VA,
Okay.
and I did that for several years when I worked with Clark. And there's a lot of benefit to having the same dentist do the IV. But what I've really learned is that I want to be able to focus on just the dentistry, right? That's why a patient's coming in to see me, to take the teeth out, to place the implants, to make those teeth, to print those teeth. And so I want that to be my sole focus. So in my practice, if somebody needs something like IV sedation, they really want to be asleep for this procedure, I have a board certified MD anesthesiologist come to my office to sedate them.
Okay, and it's just an IV line.
Correct.
And you could pull them out of it pretty quickly?
Yeah, the MD is there the entire time, and we're
I didn't know that's
monitoring
how
everything.
it's typically done. I mean, typically the person doing the sedation is also doing the procedure in the mouth.
Right, yeah. That's
So
very.
it makes sense to separate it.
To me, it makes a lot of sense, and I
good.
found that I can work faster that way too, right? Because if I've got the job of being the dentist and the anesthesiologist, right, then the procedures take a little bit longer because I'm doing two things simultaneously. But if I've got an anesthesiology team there that's doing the IV and they're monitoring the heart rate and the blood pressure and everything, then all I am doing is being the dentist.
So somebody comes in, they get a full mouth of extractions because you couldn't save them. They get a brand new set of upper and lower teeth supported by dental implants, and they have very little memory of the procedure. That's what you said?
Little to none, in fact.
Really?
Yeah.
Like they lose track of time. It doesn't seem like they were there that long.
Right. Yeah. I mean, a lot of people will say, like, "Man, I felt like I just went, to sleep 5 minutes ago." And that's a good thing about the sedation medication is that not only does it put them to sleep, it completely rids them of all anxiety. Right. I mean, people.
That's nice.
You can just kind of see like the weight off their shoulders fall off. Right. Immediately. Their body changes, their language changes. They even start laughing sometimes. Whereas, it's 10 minutes before you could see that they were a ball of anxiety. But yeah, then they go to sleep. We do the procedure. They're not conscious during it.
How soon can they eat after they get their new teeth?
Pretty much immediately, right?
Okay.
I mean, I tell them, the first day you might be a little sore, and that's normal. Take it easy. Go home, eat some ice cream, something like that. But while they're healing, there's a small diet modification, but nothing major. For the most part, people are eating whatever they want.
So when they're all healed up, I mean, they could eat like chewy or like broccoli or a carrot with their front teeth?
They can.
Or they have to be careful?
No. When they're completely healed, I mean, pretty much all food is on the table, so to speak, right? And so with a traditional set of dentures, ones that come in and out, removable teeth or teeth that have a lot of problems, the things that people can't eat are going to be really fibrous foods like raw vegetables that you mentioned, right? Salads are impossible to eat when you've got dentures.
Is that right?
Yeah, I mean, the teeth, I mean, they're plastic, right? And they just kind of slide over each other. They don't really pull apart lettuce, and things like that. People will tell me that if they're lucky enough to be able to bite into a sandwich with dentures, which is also challenging, they bite into the dentures and the dentures pop out. But if they're lucky enough to bite into a sandwich, they can't put lettuce on the sandwich because they can't bite through the lettuce, and the lettuce will just pull right out of the salad. Or the sandwich, excuse me. And so that's something that I see every single day. So when you've got a set of teeth
So are they
that
frustrated by the time they get to you and they're telling you this stuff on the console?
Absolutely. When somebody comes to see me and they've already been wearing dentures for a long time, what I typically find is not somebody who actually gets a lot of maintenance with their dentures, right? I think it's a really common misconception for people to think, well, I don't have any teeth, I've got a denture, I don't ever have to see a dentist ever again in my life. Ironically, dentures sometimes require more maintenance than a healthy set of teeth. And so when I see people that are coming in and that are hopeless and they're very frustrated, they have been wearing the same denture for 20, 30, 40 years. I mean, I can't fit into something that fit me 30 years ago. You know what I mean?
And even though, like we talked about earlier, I mean, if you have limited bone, you can do it.
Correct. Yeah, and so that's a great thing about these, these procedures, that we're talking about, where you have implants on top, implants on the bottom, and a set of teeth that go on those implants and they stay on those implants. It's not that new, believe it or not, right? But I think that more and more people are becoming intrigued by it, and they're becoming more willing to do it because their confidence in these procedures are increasing because maybe they had a family member that did it, or maybe they had a friend that did it, or maybe they watched your show, something like that. And so, of course, you need to have the right training and the right expertise to do it. But when people really want to do something about that, right, there's now options for them, right? They've been thinking that for 20, 30 years there were no options, that they just had to deal with this one denture their entire life.
And they don't go to the dentist, so they don't even know their options.
Correct,
right?
right?
Is that what's happening?
Absolutely, and we live in an amazing day and age with dentistry. I mean, dentistry is constantly evolving, it's constantly changing, and I think that is good, right? My goal is to always want to stay on the cutting edge of technology, but using technology that's proven, right? I'm not going to experiment, right? We want to know where something is going to be successful and how it's going to improve people's lives. And so the best way to do that, right, is to be open and to be constantly learning and to introduce these things to patients. But when you're not seeing the dentist for 30 years, you've missed out on 30 years of advancements, right?
And so, but the teeth look real.
They
authentic.
They do, absolutely, right. So the very first set of teeth that we get from the surgery, you would ask me, these patients are coming in and walking out with a set of teeth attached to the implants, right? And that's absolutely 100% true. The teeth that they walk out with on that day are a healing set of teeth, okay?
And they still don't come out?
They still don't come out. Okay. No, they're completely
attached to the implants. These are the ones you're printing in the other room?
Absolutely, yes, 100%. And they wear those for a few months while they heal, right? Because healing does take a little bit of time. When they are completely done healing, we transition them, into a different set of teeth, and those teeth are made out of something called zirconia, which look like these beautiful porcelain veneers, right?
Oh, that's nice.
They reflect light, like natural teeth do. There's so many different ways we can design it. Some people come in and they say, I never had straight, perfect Hollywood teeth, and that's what I want.
All right.
And so that can be designed. I've also had people come in and say, when I was growing up, I had a gap between my front two teeth, and that was like a family trait. Can I have that in my teeth? Absolutely. I mean, you can do whatever we want with these teeth.
Do you think this is the future of dentistry? Well, let's say 30 years or 100 years from now, dentures as we know them won't exist. Everything will be attached to implants.
Absolutely, absolutely.
You think so?
Yeah,
Okay.
I mean, historically speaking, when people did not have their teeth, right, if they lost their teeth for whatever reason, there wasn't a way to make teeth attached to the bone, right? I mean, years and years and years ago, there was literally no other option but just to make a piece of plastic that hopefully stayed on top and hopefully stayed in bottom. A little bit later, there were denture creams that kind of made it a little sticky, but you still have a set of teeth that you got to take in and out, or maybe replace that denture cream over and over. When I first started in dentistry, upper and lower denture was, kind of phasing out in terms of the standard of care for replacing teeth, right? Now, when people come in and they're talking about what kind of implant options do I have, sometimes we just talk about a couple implants on the lower for like a snap-in, snap-out denture, right? Maybe the upper denture's fine and they have no problems with that, and they really don't want to change the upper denture, but it's that lower one that's such a pain because it's constantly wobbling and moving around. So the standard of care has now switched from having just a removable set of teeth to at least having two implants on the bottom
so
to
at least
support
have a snap-in, snap-out
Correct,
denture.
right.
And
so,
you offer that as well?
Absolutely, yeah. Because sometimes people are like, I'm pretty okay with my dentures, right? I'd like to have some improvement, but maybe I don't need to go all the way to having a set of teeth that are completely permanent.
Okay.
And for those people, we have the options of doing a snap-in lower denture.
Are you ever on a consult where, they're telling you their bad teeth stories from their past, and they're going to move forward with getting new teeth supported by implants? Do you ever get excited, like in your mind, you're going, boy, they have no idea how good this is going to be?
Oh yeah, absolutely. There's one patient in particular that really comes to mind, and I remember meeting her for the first time, and she was telling me all about her experience with dentures. And her story kind of blew me away because out of the amount of dentures and patients that I've seen in my career, I had never heard this before.
Okay.
This woman had been married for 30 years, and her husband did not know that she had a denture.
Wow.
She woke up earlier than him every single day to make sure that she was taking care of her dentures, right? She went to bed after him every single night to make sure that he did not see her clean the dentures. And she went through this process of this very kind of secret second life, with her teeth that her husband never knew. I mean, for 30 years, she had to kind of keep this up. And so when she came in to talk to me and we were able to give her a set of teeth that truly did not come in, that didn't come in and out like her old teeth did, it changed everything. I mean, it completely changed everything. I mean, she could brush her teeth in front of her husband. She can now eat things, that she didn't eat before. And I wanted to, of course, respect her privacy because she had kept that up for so many years. And so we really worked together to make sure that she was getting a set of teeth that really looked like the teeth she had before, but now they're permanent, right?
But by the way, in Plano, are there a lot of people like that? Or a lot of people that are either headed to dentures, currently wearing dentures? I mean, is this a big problem?
It's a huge problem.
Like tens of thousands?
Not even in Plano, but across the entire United States. So we were talking about the bacterial infection that causes gum disease before. Gum disease affects more than 45% of Americans. So it's very prevalent, and it's a progressive condition. That bacteria just gets worse and worse and worse over time.
So brushing, flossing, it doesn't matter?
Not really, no. It doesn't do much, Now, if people are incredibly aggressive about trying to, control the bacterial infection, maybe they hold on to their teeth a little bit longer. For people that want to keep their teeth as long as they possibly can, we can talk about that and we can help guide them in the right direction.
Good.
But that gum disease eventually is going to get to the point where they're going to need some form of other solution.
And they're healthier when this is all done. I guess there's one less thing for the immune system to worry about.
Yeah,
when you clear this up.
100%. Any kind of infection in the body is going to create challenges for the immune system, challenges for inflammation. You know, I see things on the news and like on the internet every single day about all of the challenges that the body faces when there's chronic inflammation. Chronic meaning something that your body has to deal with day in, day out, every single minute of every single day. And if you've got a bacterial infection in your mouth, that's what the body is doing. It's constantly fighting that, and there's a lot of inflammation.
So do you see people feeling better when this is done?
It's funny because they look like they're more well rested, right? Some of the dark circles under their eyes go away, right? They look healthier, their skin is clear. There's been days when people come in and they truly don't look that healthy. You know, maybe they are, right? Other than the gum disease and the bacteria that's in their mouth, but they don't have a lot of other health problems. We take their teeth out, place some implants, get them to the ability to eat normally, right? Have a good diet, and within a week they look like a different person.
They look better.
Yeah.
Now, we're short on time, so I'm going to rush you a little bit.
Okay.
But you brought some photos, and I'd like you to kind of maybe introduce what we're looking at, kind of, and you say you're seeing transformations, life transformations every single week in your office.
Yeah.
So what are we looking at?
Yeah, so the first two patients, what I've actually asked them to do, even though I've taken patients' pictures in the office and we've kind of tracked their changes in their treatment along the way, I asked them just to kind of take some pictures, you know, in their day-to-day life. I want to see them enjoying these teeth, right? I see them in my office, but I don't see them out and about and eating their foods and hanging out with their friends. So the first patient is a gentleman who I adore. I love him. He's been a part of the practice for a long time. In fact, he brings his daughter in now. But when I first met him, he just said he was tired of constantly having toothaches, constantly having infections, and so he did not want a traditional set of dentures, right? But he also knew that he did not want to deal with struggling teeth much longer in his life, right? And so this is what we talked about. We talked about the upper implants, lower implants, set of teeth that stays in there permanently. So that's what we did for him, and I mean, he's very, very happy, right?
Looks good.
Yeah, it looks great. He looks beautiful. He looks. I mean, he's a handsome young man, anyways, right? But I mean, this just even really brightened his smile, right? He's real proud of his smile now, which makes me happy, right? Because I was able to participate in that. The second patient, again, just asked her to take a selfie of her just enjoying life. She's a unique patient in the sense that her dental anxiety was so high that she would start crying the moment she walked in the office. I didn't even have to be around her. She'd be in the waiting room. Just stepping foot inside the door would give her such anxiety. And she had some bad experience with some medical procedures in the past. And so this was something that we talked about because she was at the point where she was unsure if she could continue to take care of her teeth because coming to the dentist just gave her so much fear and anxiety that she could, one, hardly come, and then two, she could barely stand in the chair or sit in the chair to finish whatever treatment we might have been doing.
So what did you do for her?
So, did implants, right? I mean, she had some dental problems that really necessitated this, procedure anyways, this treatment anyways. But it solved so many solutions for her because she no longer has
So upper and lower teeth supported by implants.
100%.
How many implants? I mean, you say as little as 6 or 4? Or?
4 to 6. 4 to 6. Yeah. You know, the more implants.
And the full arch of teeth just goes right on top.
100%, yeah. I mean, it's, when I do this procedure for like engineers, they like want to really get into the details about it. They want to ask every single, connection and everything. And I love talking about that if they're interested. But really, for the most part, the most basic thing that you need to know is that, it's 4 to 6 implants top, 4 to 6 implants bottom, and a set of teeth go on those implants and do not come out. So my third patient, I have a before and after, what we started with and what we ended with. Because this is a patient who was very unhappy with the appearance of his teeth. You can see missing teeth, you can see broken teeth. There was a lot of embarrassment for him, And so I thought that this was an important photo to show because it really shows how different something can be, right? How dramatic the change can be. Yeah. And then the last patient, that I'd like to display, it's a little bit different because we're here to talk about how we can transition somebody in from traditional dentures to implants.
Yeah.
Or if you've got a bad set of teeth, we can get you implants and get you fully functional with eating, chewing, all the good stuff in life. However, the other thing that I really enjoy doing in my practice is Invisalign. If people have a healthy enough set of teeth to save, and we can save them, then what I'm looking for is how can I improve that for people. And I had a patient in my office because all of my exams, whether you have teeth or don't have a teeth, they all start with a scan of your teeth, a digital scan. And the teeth come up like on a 3D screen, and we can rotate those teeth.
So she didn't like her teeth at all?
No, and she made a comment. She's 76 years old, and she said, "Man, I hate my teeth. What can I do about them?" Right? And I said, "What did you like about your teeth?" And she was like, "Oh, they're crooked and they look weird. And I've wanted braces my entire life." And I said, "All right." And I was like, "Well, let's do it." Right? And she was like, "Can I?" She's
so
like,
at 76, you could still do this?
Yeah. So we did Invisalign for her, and every time she comes in the the office. She says, thank you so much for this, because I didn't think that I could. And the best part about this entire thing is that her granddaughter was doing Invisalign in a different state with another dentist, right? So now she gets to talk to her granddaughter about their Invisalign treatment. But the point is that I think maybe a lot of people had dismissed her because of her age, right? Or she had put herself in a category where she thought that she was too old to get some of these things. And so, she wasn't in the need for full mouth implants. She didn't need implants on top and implants on the bottom. She didn't need a set of dentures. She needed more confidence, right? And we did that with Invisalign. And so at my office, right, one of the things that I really like to tell people is that there's not a one size fits all dental solution for everyone.
You save teeth when you can, right? I mean, there are some people that think 100%. That they need all of their teeth removed. And so you do a lot of things like root canals. You do in-house. Where, I mean, you're doing things that typically you may need 2 or 3 specialists.
Yeah.
You take care of it right there.
I do everything I possibly can to keep all of my treatment in-house. It's very rare that I refer somebody out. If we do, we talk to the patients about the reasons why, but I would say 90, 95, maybe even higher % of all procedures are done in my office, because we have a relationship with them, we've established trust, and I want them to continue to come back to an office that they know and trust.
Now, what about patients that, and we talked about this in the green room, they've been told they don't have enough bone, you can't get dental implants. You're saying that's not true anymore, at least with your training.
Correct.
Can you elaborate on that?
Yeah.
We're short on time.
Absolutely, yeah. So historically, people were told over and over again that you had to have a certain amount of bone for implants. There's so many different designs and styles of implants, right? And so not only do we have a wide range of types of implants in terms of size and length that we can use, the placement of the implant has become unique, right? Where it used to be a little bit different. And also, there are very unique types of implants that we can use that are stabilized in different bones, in the mouth. Right? That old bone that used to hold the teeth in, that's not the only bone that we have to use for implants when we're supporting these teeth.
So if somebody's been told they don't have enough bone, you'd like to see them?
100%.
Do they get to see you on the consult?
They always see me on the consult, because I'm going to be the one that is going to be designing the teeth with them, that's going to be talking about what their goals are, right? Be deciding the placement of the implants, taking the teeth out, placing the implants. It's very, 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 very rare that somebody is not a candidate for the traditional version of this type of treatment, okay? If somebody truly needs a very, very unique type of implant, it's possible that I might involve an oral surgeon, but that's not a high percentage of people. And if we do work with an oral surgeon, I am guiding the treatment the entire way, because I want those implants in a particular location, and that's what I communicate with the oral surgeon, so I can put the type of teeth that they want on those implants.
We're out of time. So what if somebody's watching this? They're the 2 categories. They still have teeth, but they're really, really bad, and they're worried they're going to end up in a denture. Or the denture wearer that's watching this. Maybe they haven't been to the dentist in a long time. They've heard what you have to say, but they're still skeptical. What do you say to them?
It starts with a phone call, right? They call the office, we schedule a consultation, they come in and meet me, they meet my team, and we answer all their questions, right? I mean, I think that's the biggest thing that contributes to fear, is the unknown. We want them to be well informed, we want them to know what their options are. More importantly, I want them to know that there are options, and I think that's where a lot of people are so hesitant to start this process, because they feel like there are no options out there. And maybe it's a time in their life where they start something like this, maybe it's not, but they at least need to know that we're around and we're there for them when they're ready.
Okay, good. I want to thank you for coming on the show. Great stuff.
Absolutely. Yeah, thank you for having me.
You've been watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. For now, I wish you good health.